From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours provides an outstanding patient experience. And that's not just us saying that. We got that from HealthGrades. 5 Bon Secours hospitals, in fact, received the Outstanding Patient Experience Award from HealthGrades. HealthGrades is the leading online resource for comprehensive information about physicians and hospitals, and each of the 5 hospitals was identified as providing outstanding performance in the delivery of positive experiences for patients during their hospital stay. To be eligible for the HealthGrades 2014 Outstanding Patient Experience Award, 3,582 hospitals were evaluated by HealthGrades on patient surveys submitted to the Centers for Medicare and Medicaid Services. Of these, 3,000 hospitals met the additional clinical quality requirements to be considered for the distinction. And only the top 15% of this group, or 447 hospitals, achieved the award. And the 5 Bon Secours hospitals that received the award: Bon Secours Our Lady of Bellefonte Hospital in Ashland, Kentucky. By the way, this was the 7th year in a row for Our Lady of Bellefonte Hospital. Bon Secours St. Francis Health System in Greenville, South Carolina. By the way, this was Bon Secours St. Francis Health System's 7th year in a row as well. Bon Secours St. Francis Hospital in Charleston, South Carolina. Roper Hospital in Charleston, South Carolina, and Centera Princess Anne Hospital in Virginia Beach, Virginia. Please join us in recognizing these outstanding hospitals for achieving the HealthGrades 2014 Outstanding Patient Experience Award. Proof that our strategic quality plan goals are not just words on paper, as we strive to ensure our care is extraordinary. In other news, can you imagine a world without cancer? Well, in 1971, then President Richard Nixon declared a war on cancer with that goal in mind. As part of the war on cancer, President Nixon signed the National Cancer Act, aimed at strengthening the National Cancer Institute. Since then, some $3 billion has been spent in cancer research, and in 2014, an estimated 1.7 million people will be newly diagnosed. Enter Bon Secours researcher and surgical oncologist Bjorn Brucher, MD, PhD, FACS of Bon Secours Virginia Cancer Institute. Dr. Brucher and 25 other nationally and internationally recognized cancer scientists have proposed new anti-cancer strategy entitled Imagine a World Without Cancer. According to these scientists, an optimal anti-cancer strategy is an integrated and personal approach to care and treatment predicated on disease, patient, and individual response variables. In other words, one size does not fit all. According to Dr. Brucher, curing cancer is far from being realized, and to reach this goal, scientists and clinicians should join forces. He goes on to say that the cancer scientists conclude that eradicating cancer will require a standardized approach for diagnosis and treatment of cancers and must take a leap from the service-based approach to an outcome-based approach, calling for personalized and individualized anti-cancer strategy for diagnosis and treatment. The Bon Secours Cancer Institute team members combine the science to cure with the art of compassion. At Bon Secours Cancer Institute, world-class surgical, medical, and radiation oncology experts, certified oncology nurses, and support staff collaborate to offer the latest and most effective inpatient and outpatient cancer treatments. You can read the complete story on the Bon Secours Hampton Roads Health System website in the newsroom, or go to www.biomedcentral.com. Finally, 8,000 hours might seem a lot to most folks, and volunteering for over 8,000 hours just seems epic. But not for Naomi Runyon. Her response to finding out she was receiving an award for reaching 8,000 volunteer hours was, "How can that be?" She went on to say that, "But there it is. It probably could have been more, but I love to travel, so that took away some of my volunteer hours." Our favorite volunteer, Naomi Runyon, has for nearly 34 years volunteered at Our Lady of Bellefonte Hospital in Ashland, Kentucky. Her preference is volunteering in hospice. She likes to visit with the patients because there are many times hospice patients have no family around. For Naomi, there was just something that drew me to be with the older and the sicker. Naomi was recognized for her service on April the 9th, 2014, with a luncheon honoring all Our Lady of Bellefonte Hospital volunteers. And as an added surprise, Kentucky State Representative Tanya Pullen presented Naomi with a certificate of appreciation from the Kentucky House of Representatives for her dedication to the community. 8,000 hours of volunteering. I've got to say, that certainly is good help to those in need. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.